Good afternoon, everyone, and thank you, AIS, for giving me the opportunity. So I will be speaking on artificial intelligence-based smartphone applications in ophthalmology. So this mobile-based technology is the future of telemedicine, and these outreach activities would be centered around the home. Especially we learned this thing during the COVID time. And the visual acuity and visual field screening apps, there are a lot of availability, and they are capable of detecting visual degradation even before they present to a healthcare professional. And the patient feel more engaged and improve their compliance with these applications, and the smartphone applications are capable of improving the disease outcomes. So there are more than 700 applications with eye care themed, and out of this 259 applications are of some or the other use for the general health care, and 131 applications are relevant exclusively for the ophthalmic practice. Regarding the cost, 76% of the applications are available free of cost, and 22% need a monthly or annual payment, and in about 2% of the applications they provide free trial also. As we see the distribution of application as per the utility and operating system, so they range from the vision screening, eye exercise, professional education, data collection, up to amblyopia. As per the reviewer rating and validation, because that is the most important aspect of these applications, so it lacks in this perspective. So 13 applications had more than 500 reviews, and all designed for these eye care professionals, and this eye test application designed for general public, they have the largest number of the reviewers ratings, and the application with maximum reviewer rating is a smart optometry app with 50,000 download and 680 reviews. Validation, very important aspect, only 4% application are claimed by the developers to have undergone some validation test, and My Vision Tracker is the first ophthalmic application to be US FDA approved in 2014. And as we look the mind map of the scope of this smartphone application eye care, so it ranges from the e-books, surgical videos, to the vision screening, and in the eye exercise also. So I will take examples of few of these applications because time is only 7 minutes. So first is the peak acuity application, which is highly validated, developed by the International Center for Eye Health, Department of Clinical Research in London. And this is an efficient tool for the school screening and can be used by non-ophthalmic staff in emergency. Ophthalmology guide, well organized and topic oriented ebook application, systematic detail of every topic and subspecialty including latest ophthalmic instruments, clear categorization makes very convenient for the ophthalmologist. iTube application, just like YouTube, so it is a global ophthalmic video pool. It collects the professional videos related to eye, and aim of ophthalmological education and surgical video with free access and breaking news and cutting edge videos of ophthalmology, and they are updated every day. Community eye care application, it is a free online and offline access to peer reviewed articles. It aims to improve the standardization and enable easy access to eye care knowledge for all categories. Eye handbook app, and this is a diagnostic and treatment reference, so one-stop shop for multiple need of the ophthalmic practice. It offers a dozen features to both ophthalmologists as well as eye care workers. Smart optometry, these are eye tests for the professional applications, various vision screening tests including color vision, near vision, amblyopia, Würzburg dot test, Hirschberg, and the Amsler grid. And the advantages, it is available in 11 languages. Then comes the MVD. This converts the Apple smartphones into a medical device. It tracks the progression of vision damaging disease such as age-related macular degeneration and diabetic retinopathy. Patient test data are automatically uploaded to a physician portal for monitoring, and they are validated as a remote monitoring tool at home to track treatment effects and to detect disease condition changes. And All Eye is another application which is also FDA approved for monitoring maculopathy. Then from some Indian innovation, and this is toric IOL access marker developed by Dr. Girish Jethwa and Mukesh Dholakia. iToric Patwardhan developed by Dr. Saurabh D. Patwardhan. Then I know Tamil, I know Bangla. So from the North India, a lot of residents, they are coming to the down south. So they have language problem. They are not able to understand what the patient are saying. So it's a very good application developed by this Dr. John Davis Akara and his team. So it converts the Tamil language into English, and also it is available in Bangla, and we are working with the Telugu version. So I am part of that team. So very soon it will be available. Then Dignify for the blind people, developed by the Arvind Eye Hospital. So any text, it is converted into English or Hindi. So it is a very great application. Then Vikas, so it is a visual intervention kit with analytics for the specially able children. So there are visual exercise, especially for the children who have cognitive visual deficiency, patients of autism and cerebral palsy. Then OggleCamp, because medical records are very important. So it is developed by Dr. Sunil J, and it is available free of cost, and it helps in the teleophthalmology consultation platform, and also helps in smart referral if the other doctor has the same application. So all the data will automatically go to that physician. So regarding the conclusion concerning the professional educational applications such as the eye handbook and eye emergency manual application, institutes and or individuals, they need to endorse and make suggestions. These applications dedicated to professional use must also be peer reviewed and validated. That is purely absent, only 4% are validated. And studies are need to understand the readiness and concern of eye care professionals in adopting the mobile health, and guidelines to choose an appropriate application needs to be suggested. Importance of interdisciplinary collaboration in the design, development and validation of these applications is a must. Thank you so very much.
Thank you, Dr. Morya. And I think we are already running late. I would invite in something from the audience if any questions are there. There's a request. And all these are validated, the ones you told us about? Not yet.
Only 4% out of there are 750 applications. So only 4% are validated. So this is the negative thing about these applications. And most of these applications are not developed in collaboration with the eye care professionals like the PhDs or ophthalmologists. So this is the problem.
What do you think are the issues with, for example, screen brightness, screen color changes, the comfort mode, the night mode, everything changes, the colors, the illumination, everything. So how can there be a standardization? Across phones, their screen looks different for the same apps, for the same. So how do you think there can be some standardization?
We need to collaborate. I told you at the end that interdisciplinary collaboration is a must, because we need help of IIT engineers also. We developed one application, so we took help of 8 IIT engineers. So that totally taken care of the contrast, the brightness, because it's a problematic. The digital vision syndrome is becoming an epidemic. So all these things needs to be considered, and involvement of the eye care professional is a must. That is lacking in most of these applications, and no validation at all. Only 6 of the applications they are validated out of 700 that are related to ocular health.
Thank you, Dr.